everyone. Today I will present using natural language processing to extract Kawasaki disease symptoms from clinical notes. My name is Ruiling Liu. I'm a second-year graduate student from UT Health Science Center Houston. My mentor during this summer internship was Dr. Sang Dong, and my co-mentor was Dr. Nashi. The aim of our project is to extract Kawasaki disease symptoms from clinical notes. Currently, the recommended diagnosis of Kawasaki disease is based on presence of fever for more than 5 days and 4 out of 5 clinical features. Since these features overlap with many other diseases and are not typically present at a single time point, they tend to be overlooked initially, resulting in missed opportunities of treatment. In fact, 4 KD patients lost their young lives in the past 20 months at Randy Children's Hospital due to late diagnosis as of June 2014. Since there's no existing NLP framework for identifying KD symptoms, so we propose a timely solution that will provide a systematic method to screen through narrative clinical notes to identify potential KD patients. This is our general NLP framework, which contains 4 components: annotation guideline, KD symptom recognizer, visualization, and collaborative annotation environment. First, I will introduce our annotation guideline. The diagnosis of Kawasaki disease is based on fever time, clinical findings. My presentation will focus on clinical findings. These findings are extremity changes like redness of hands or feet, polymorphous eczema, rash on body, conjunctival injection like eyes or eyes, changing lips and oral cavity like have strawberry tongue, cervical lymphadenopathy like each left side of the neck was red and swollen. Since there's no existing annotation guideline for annotate Kawasaki disease, so in consultation with Dr. Jane Burns from Kawasaki Disease Research Center at UCSD Randy Children's Hospital, and based on the paper, diagnose, treatment, and long-term management of Kawasaki disease. Our annotation guideline team created this annotation guideline for identify Kawasaki disease symptoms in clinical text. Our annotation guideline team contains 3 physicians, 3 computer scientists, and 2 linguistics. This is a screenshot of our guideline, which includes definitions, patterns, both positive and negative examples of entities that we need to annotate. Next, I will introduce our split the notes into sentences and run through our KD symptom tiger to identify those symptoms. And finally, we will visualize our data in a very nice format. The most difficult part in this pipeline was KD symptom tiger. At first, we only have 6 clinical notes to build our system, so we decided to use a rule-based approach, regular expression, to build our system. This is an example from the clinical notes. Today, hands and feet appeared red and swollen. Palmar plantar, the red and swollen can be replaced by red and swollen. This is next example. Today we have noticed her as well as fuller lips. The keywords here are fuller lips, and the fuller can be replaced by dry, red, correct peeling, bleeding, chapped. This is a negative example that we will not annotate as a KD symptom. No rash on hands or feet because there's a no in front of rash on hands and feet. The no can be replaced also by and the rash can be replaced by eczema and erythema. After we After identifying those symptoms, we want to visualize our results in a very nice format. So we created a web-based application. To guarantee the security of our data, users need to connect to iDASH VPN, and username passcode are required to log in. After login, you can see our application. User inputs clinical notes on the left side of screen. Click submit button to run through pipeline and display clinical notes with highlighted clinical findings. I created the front end of this application using HTML, CSS, Ajax jQuery, and I create the back end symptom tagger using Python and combine the front end and back end using PHP. This is a resulting example from our application. Dry lips is lips in oral cavity, right bilateral eyes is conjunctival injection, rash on her arm and leg is a polymorphous angioedema. Neck has tenfold is cervical lymphadenopathy. Hands may be a little bit swollen is extremity changes. Collaborative annotation environment. So to measure the performance of our own system, we need to compare our results with gold standards. Since there's no gold standards there, so we need our physicians' help to manually annotate the clinical notes and create the reference standard for us. So we set up a secure collaborative annotation environment within iDASH for 3 physicians to create the reference standard. Currently, 30 de-identified notes from Randi Children's Hospital for annotation are in progress. This is the existing annotation tools that are installed for the physician to annotate, named Brett. Preliminary results. 8 de-identified notes from Randi Children's Hospital are manually annotated by a physician in the hospital. 6 notes are from KD patients, 2 notes are from non-KD patients. And there are 64 mentions of KD clinical findings in these 8 notes. We use precision record F-score to measure the performance. From the table, we can see that the polymorphous eczema is 0.74, conjunctival injection is 0.7, lips and oral cavity is 0.87, and extremity changes and cervical lymphadenopathy are a little low. So we look back to data, and we found there's a lot of false negatives in extremity changes, which means they are KD symptoms, but the system failed to identify KD symptoms due to the synonyms. And as for the cervical lymphadenopathy, we found a lot of false positives, which means they are not KD symptoms, but we identify as KD symptoms because we haven't added negation in our tagger. We are still working on the annotation guideline, and our system will improve it. So the challenges here are, first is medical terminologies, and second is synonyms. Summary of my work. Since it's a big project which involves many people, I involved in this project and like annotation guideline, collaborative annotation environment, and I'm mainly focused on KD symptom recognizer and visualization. Internship experience. During this internship, I contributed to build the first NLP framework to identify Kawasaki disease symptoms, and I contributed to develop a bio-NLP application from scratch. And I also learned how to cooperate with domain experts to create annotation guideline and set up the collaborative environment for annotation. The aim of our project is to build a general NLP framework to identify Kawasaki disease symptoms. Our future direction are refine our KD symptom tagger, evaluate it on more clinical notes, and after we get better performance, we will submit our work to EMEA Joint Summits on Translational Science. So here I would like to thank our annotation guideline team, Divya, Ruiling, Sisi, Amanda, Mark Song, and our annotators, Divya, Wen, Cleo, they are all MDs, and Erico Barry for helping to collect data, CTRI for setting up secure environment in iDASH, and my mentor, Dr. Sangdong, co-mentor, Dr. Chen Nanxu, and Dr. Jane Burns, Dr. Lucila Ono Machado, Dr. Xiaojian Zhang, Dr. Shao Wang, iDASH, DBMI, and also NIH for funding this project. Thank you. Color code? This one? Yeah, because diagnosis of Kawasaki disease is based on fever time, and 5 clinical findings. So like the blue mark here is 5 days, which means it's a fever time. And there's a pink label, means it's a fever. And the brown one, rash, means polymorphous eczema. So like it's an existing annotation tool. So the doctor will select the words and select their category. Yeah, it's configurable. And you can configure it. Yeah. Thank you. Oh, hi.
I'm glad you're doing that because Kawasaki, I'm an emergency medicine physician, and Kawasaki disease is one of those things that you have to think about in every little kid that shows up on your door with a fever that by and large it's going to be very hard to find because it's going to be some viral syndrome or something like that. However, I was wondering if you guys, when you develop your model, if you're going to be comparing it to, because frequently, we're going to be writing notes on these patients, and if we don't think it's a disease, it's not going to be charted that way. So these notes are based on patients who have already had the diagnosis stage, I'm assuming. So it might be helpful to compare, once you have your model about it, compare the notes where the diagnosis was initially, either in the clinic setting or in the emergency setting, and kind of compare the data to see what exactly was being missed out of those notes. Because if you want to catch the Kawasaki disease presentation, you're going to be, so for example, when I write my notes and I'm not thinking about Kawasaki disease, there has to be things that I'm typing that I'm not thinking about. And it may help that the system can recognize, hey, you have 4 out of 5 Kawasaki disease criteria in your note. Did you think about it? Something like that. But I was wondering if that was something that was going to be developed later on in the process.
Yeah, thank you for the suggestion. We will think about it later program. Thank you.
Thank you. Our next speaker